Hey, if you've clicked on this video, we're going to be going through what I call wall sit progression. That's really all it is. This is not, again, following our normal pattern of mobilize, stabilize, stretch. It kind of is because we'll go through some mobility stuff first. But what it really is, I wanted to have a video for my patients because I tell them about this all the time. If you have really bad knee pain, specifically like patellar tendonitis, if it's right up here, they call it runner's knee, jumper's knee. There's all sorts of names for it, but it's like that tendonitis. But it can really be any knee pain. Oftentimes we'll give, like I've got knee rehab, but the knee rehab takes, you've got to set up tubing and it takes a lot, whereas these wall sits are simple and easy, but can be kind of painful. So if you're not careful with them, you can progress too quickly and then you can irritate it. As always, we follow rule number one. Rule number one is no pain. So when we're doing these, you want to actually find that edge of pain. These exercises are really geared for people who are really, my patients who are like, my knee is just really, really hurting. I'm trying to avoid a surgery, or you want to see how strong you can get it. By adding strength, you can get rid of pain. So that's what this one is. It's a slow progression to be done over time. And if you do this and are careful with it, you can kind of work to the point where you can start getting back to your bigger movements and do more rehab, more exercises, more gym work. So this is just a wall sit progression that we're going to be going through today. So enjoy the video. Okay, so as we break into these, we're going to go to the first one, which again, we're not following the mobilize, stabilize, stretch, but this first one is a mobilization, but it's also a stabilizer. So again, as you see, I'm kind of leaning against a wall that you'll be able to slide on. So I've got a shirt, and all I'm doing is light mobilization. So we're ducking down. Now imagine what I'm doing here is in my head, I'm saying, I'm going to the point where I feel the edge of discomfort, but don't go to pain. And so you're going to just go through some mobilization. Saw how quick that was. I'm going to, we'll maybe pop it up 2 or 3 times so you can kind of see. All I'm doing, I did 10 mobilization where I just bend the knees. You're going to drop down to the point where you feel that edge of discomfort, but no pain. And that's what we're going to start with, okay? This in and of itself can be your first exercise that you can do every day. So what you want to do is find where you're at on your pain levels. If this is as much as you can do, that's fine for day number 1. I do like using this one as kind of a gauge as well. So if you're going to move on to number 2, which is a hold, you can maybe start with some mobilizations and see how it's feeling that day. What you want to do is kind of progress where you're going a little deeper and a little lower and working a little more each time that you do these exercises. So this mobilization is a nice little gauge of saying, like, where am I at today? Each day you want to get a little lower. Don't be frustrated if one day it's flared up. Just, you can ice it at the end of the day, work on the inflammation. But this is a nice mobilizer, tester, and a good starting 1 progression, okay? Then we're going to move on to number 2. Number 2, as I said, is just a hold. But what we're going to do is the hold is you're going to go up against the edge of discomfort. So notice I say my knees are hurting. I'm going to drop down. You're going to notice I'm not going to go super low. Normally we go to 90 degrees. I say right there. Okay, so you feel the pain, push up, go against the edge of discomfort, and we're going to hold. I'm holding this one for, I think I do like 12 to 15 seconds. You can do anywhere from 10 to 60 seconds, especially if you're getting towards the end of that progression. Like if you're feeling strong, hold for 60 seconds, and then the next day you're going to go a little lower. So notice I'm repeating, going a little bit lower. This is basically the next day. So the next day you're going to go a little bit lower. You're going to find that edge of discomfort, back off of it just a little bit, and hold for anywhere from 10 to 60 seconds. And then I say this, I'm repeating. This is a day-to-day progression. You want to repeat that, whether it takes you 2 days, 10 days, 15 days. Stay consistent, drop a little bit lower until you can get, so notice I'm at 90 degrees. You want to progress until you're at 90 degrees, and you can hold that for at least 10 seconds, maybe a little bit longer. That's the indicator that you're getting stronger. Again, no pain or minimal, like 1 to 2 out of 10. Slight discomfort's okay, but just be careful with the amount of pain. These are designed to progress until you're strong with no pain, okay? So that's the progression. Hopefully that makes sense. You're just every day trying to get a little bit lower, a little bit deeper, to the point where you can do those with no pain. Then we're gonna move on to the last one. Last one's tough. So we're basically gonna do the same type of progression. You're gonna go down to the point where you are feeling no pain into a 90 degree. Now with this one, you may wanna back up just a little bit. So come back up because we're gonna do a single leg wall squat. So notice this first one, I'm not down as deep. This one, and where the wall is slippery, this one's hard. I like slide off to the side. I'm holding this one for, I think I do like 10 to 12 seconds. But you can do anywhere from 10 to 12 to, again, 60 seconds. If you can do a 60-second single leg wall sit hold, you are impressive. You've practiced and progressed, and that's something that you want to be able to work up to. But in this, go to your single leg wall sit and just try to progress as low as you possibly can. You want to get to the point where you're at 90 degrees. Notice I'm not at 90 degrees. This one's tough. And it's not just tough to like hold. I feel like my leg and knee's okay. I always like tip. So it's more trying to hold the stability. So this last one, I'm still not to the point where I can do a 90-degree single leg wall sit. So I could do this progression and you're just going to get stronger and stronger. That's the key. The key is you're getting better and better and a little deeper and a little bit harder every day until you're to the point where you can do this exercise with no pain and you're strong, and you're going to add stability into your quads, even into your hamstrings, the lower legs, the calves. This works them all. You're going to turn your pain into power, your weaknesses into strengths, and you're going to get past that knee pain. But this one can take a while. So again, seated knee progressions, you can work from this point, and halfway through you can do more rehab, but this is a really good progression that you can do with just a slippery wall, and it makes it simple and easy. So go out. I wanted to make this one to help with my patients because I talk about this one all the time but didn't have a video or a sheet to do it. So go get it done. Get past that knee pain. See you guys.